Here we go then. Thank you, sir. My screen visible to everyone?
Very well.
Okay. Thank you, sir. So we're gonna discuss nutrition and public health part three. This is a lecture series, as majority of you people already know. These topics are very important and very detail oriented topics. So in we have to discuss the topics in a series of lectures, in a series of classes, and we cannot just cover in them in a single 1 hour class. That's why it's a part three of our lecture. And as I already told you, I have omitted the minerals out of it because I could not cover the minerals within 1 hour stipulated time. So understanding vitamin deficiency disorders. As you already know who I am, I'm Dr. Omer Farooq Khan. I'm a resident orthopedic surgeon working in Rawalpindi Medical University here in Pakistan in a teaching hospital called Benazir Bhutto Hospital. So the learning objectives for today's class are, first of all, introduction, then brief summary of previous class, then basic definitions, fat soluble vitamins and their deficiency disorders. Yeah, we will cover fat soluble vitamins first. So fat soluble vitamins and their deficiency disorders, then water soluble vitamins and their deficiency disorders, then how to overcome vitamin deficiencies in general public. So, as discussed in previous classes, we are what we eat. At the most basic level, the concept of having good nutrition means eating a regular, balanced diet, as nutrition is the thing which keeps our body systems running optimally all day long. The foods we eat supply our body with the needed nutrients to maintain our brain, muscles, bones, nerves, skin, blood circulation, and all the organ systems and immune system. Proper nutrition also helps us protect from illnesses and many diet related diseases. So, brief summary of previous class. In the previous class, we discussed the topics of we developed an understanding of the concept of malnutrition, then overnutrition and its side effects, such as obesity and metabolic derangements related with the obesity, were discussed. Undernutrition and its subforms were discussed, such as marasmus, kwashiorkor. Understanding of protein energy malnutrition was made. Various clinical syndromes of PEM, such as marasmus and kwashiorkor, were discussed. Approach towards child with severe acute malnutrition was also discussed. So we discussed all of the things related with protein energy malnutrition or macronutrient deficiencies as well. But now we are talking about micronutrient deficiencies, and in micronutrients there are vitamins and minerals. So what are the important definitions? Nutrition is the process of taking in food and converting it into energy and other vital nutrients required for life. In the process of nutrition, organisms utilize nutrients. Then there is nutrients. Nutrients are the substances essential for growth, maintenance, function, and reproduction of a cell or an organism. The absence or deficiency of any of these may result in poor health or disease of organism. So undernutrition is defined as low weight for age, low height for age, or low weight for height in children or adolescents. Chronic energy deficiency is a condition of being underweight among adults as a result of prolonged negative energy balance. BMI value of less than 18.5 indicates CED. We already know what is kilocalorie. I will not go into details. We'll just go hop on to our today's topic. So our today's topic is vitamins and their deficiency disorders. This section will elaborate the topic of vitamins, fat soluble and water soluble, including their deficiency disorders. I have omitted the minerals along because I could not add minerals in today's class. It would have made the presentation file very long and very difficult to cover within an hour. So, fat soluble vitamins. Fat soluble vitamins are vitamin A, D, E, and K. They are present in foods containing fats such as dairy products and meat products, etc. The body absorbs these vitamins along with dietary fats as it does dietary fats. They do not dissolve in water. So, fat soluble vitamins are hydrophobic, they are lipophilic. Hydrophobic substances are those who have phobia with water, who are not soluble in water, and they are lipophilic, means they dissolve in fats. They dissolve with any fatty substance, fatty solvent. So vitamin A is a fat soluble vitamin. We get it from green leafy vegetables and carrots. It helps in vision, reproduction, bone health, immune system, and skin. Then there is vitamin D, which strengthens our bones. It helps in calcium absorption from our gut and kidneys. It also helps our immune system. Vitamin E also helps our immune system and flushes toxins. Then there is vitamin K. It helps in blood clotting and bone health. Vitamin A. So vitamin A is called retinol, or retinoic acid. The sources of vitamin A are it's found in leafy vegetables, example given carrots. It's also present in meats and dairy products. It's found as carotenoids that are metabolized in the body to active vitamin A, where it's stored in liver cells. Function: synthesis of rhodopsin, cell differentiation and growth, antioxidants. So basically, it helps in vision, it helps in cell differentiation and growth of the body, and it is also an antioxidant. There are several derivatives of vitamin A which are involved in multiple different metabolic processes, including immune functions of the body. 11-cis retinol is involved in the synthesis of rhodopsin, the visual segment in retinal cells. So the visual pigment is the pigment which helps us in seeing things. So when rhodopsin is made by vitamin A, we are able to see things. That's why vitamin A deficiency causes night blindness. Retinoic acid acts to regulate cell growth and differentiation. Then beta carotene. All of these are basically isomers or sister substances of vitamin A. So basically, all of these are needed in the body for different functions. Beta carotene, a precursor for vitamin A, has been known to act as an antioxidant. So retinoic acid helps in growth and differentiation. 11 says retinol helps in vision, and beta carotene are antioxidants. Then causes of vitamin A deficiency include fat malabsorption syndrome such as pancreatic insufficiency, cholestatic liver disease, celiac disease, inflammatory bowel disease, and gastrectomy. So all of the conditions in which the absorption of fats is impossible or is difficult, the vitamin A also, or fat soluble vitamin, being a fat soluble vitamin, also gets deficient in the body. Pancreatic enzymes help in fat absorption and fat digestion. So when there is pancreatic insufficiency in the body, you will not absorb fat soluble vitamins. Subsequently, vitamin A will not be absorbed in the body. Then cholestatic liver disease, when gallbladder juice is not being secreted down into the gut, then also fat emulsification is not being done, and vitamin A is a fat soluble vitamin, so fat emulsification is not being done, so digestion process of fats is impaired. That is why vitamin A deficiency will occur. Similarly, celiac disease, inflammatory bowel disease, these diseases result in destruction of intestinal villi, and when intestinal villi get destroyed, then there is no absorption from the intestinal cells. Then clinical manifestations of vitamin A include early symptoms include night blindness, poor wound healing, increased susceptibility to infections, and whiteout spots. Whiteout spots are white patches on the conjunctiva. Later symptoms include hyperkeratinization and resulting skin dryness. And when skin gets dried, it starts getting damaged. Then ulceration and keratinization of cornea as well. So whenever the cornea gets ulcerated, its keratinization is basically a keratin layer formation on the epithelial cells, where previously there was no keratin. Eye has no keratin. Skin has keratin. Skin epidermis has keratin, but eye has no keratin. Similarly, our oral cavity mucosa, inside of our mouth and inside of our gut, these mucosal linings have no keratin. Keratin gives strength. But when there is keratinization of some soft tissue area, such as cornea of the eye, then blindness occurs because cornea gets hazy. Treatment with vitamin A supplementation is 30,000 international units daily for 1 week for early deficiency, then 20,000 international units per kg for 5 days for late deficiency. So, early signs of deficiency can often be reversed with supplementation. If there is an early deficiency of vitamin A, yes, the permanent damage is not done yet. So, you can reverse night blindness, you can reverse ulceration and keratinization of cornea, you can reverse whiteout spots, you can reverse immune deficiency problems. But when there is chronic deficiency, then there are some changes in the body which cannot be reversed. Toxicity with vitamin D K also occurs. So toxicity occurs with ingestion of more than 50,000 international units per day of vitamin A for longer than 3 months. So vitamin A source is vegetables. Clinical presentation is patient comes with night blindness. So patient comes with the complaint that he can see at daytime, but he can't see at nighttime. Then there's ocular keratization, the xerophthalmia and whiteout spots. Xerophthalmia means dryness of eyes. Xeros means dryness. So xerophthalmia means dryness of eyes. There is no tear production in eye, so eye always keeps getting painful. Systemic keratinization occurs. There is squamous metaplasia. I cannot go into details of squamous metaplasia, but you can just understand that keratin layer start forming at those mucosal areas of the body where keratin should not be present. Then there is immune deficiency problem as well, and vitamin A is treated with vitamin A supplements um, present at pharmacies, local pharmacies. Then vitamin D. So vitamin D is also a fat soluble vitamin. Vitamin D can either be absorbed intestinally or synthesized in the skin by ultraviolet radiation and then hydroxylated by either the liver or the kidney to form potent metabolites. So vitamin D, the active form is vitamin D3, which is 125 hydroxyl cholecalciferol. For the most part, humans derive vitamin D in the forms of vitamin D3, which is cholecalciferol. Vitamin D3 is derived from its endogenous synthesis in the skin from precursor. So the precursor of vitamin D3 is 7-dehydrocholesterol. So basically, cholesterol is a precursor of vitamin D3. So vitamin D3 is formed in our skin in a photochemical reaction that involves solar or artificial ultraviolet light. So basically, if we sit in the sun, then 7-dehydrocholesterol in our skin epidermis starts getting converted into vitamin D3 due to the reaction being catalyzed by this ultraviolet light. Then vitamin D2 is a plant form called ergocalciferol or ergosterol. We convert this ergocalciferol in our body to vitamin D3. Functions: increase the serum calcium level through increased absorption in kidney and GI tract. Vitamin D is involved in stimulating the synthesis of calcium binding protein found in the intestine, and thus is involved in increasing intestinal calcium absorption. Vitamin D also acts in conjunction with parathyroid hormones, stimulates osteoblast activity, leading to bone demineralization and calcium released into the blood. Calcium reabsorption by the distal tubules by the kidney. Vitamin D assists in bone growth and integrity of bone and promotes strong teeth as well. So vitamin D, as we already know, it's a bone vitamin. It helps our bones. But there is not just the benefit of the bone with vitamin D3. We also need strong teeth. We also need good immune system. We also need optimal calcium levels in our body. It also helps to regulate the amount of phosphorus in the body, as well as assisting in a healthy heart and nervous system. So, skin forms vitamin D3, endogenous synthesis in the skin from photochemical reaction. Plants give us vitamin D2, which is ergocalciferol or ergosterol. And the vitamin D is stored in liver in the form of 25 hydroxyl vitamin D, and kidney converts, yeah, it into 125 hydroxyl vitamin D2, vitamin D. So basically, this vitamin is active form. So our causes of deficiency, as already we have discussed, inadequate sunlight exposure and malabsorption, liver failure, renal failure. So if we are suffering from any malabsorption syndrome, just like vitamin A. We discuss in vitamin A. If any disease, any malabsorption disease is there, we will not be able to absorb vitamins, just like any other thing. And if there is liver failure, if there is renal failure, there is a role of liver, there is a role of kidney in hydroxylation of vitamin D. So when there is liver failure or renal failure as well, so active form of vitamin D is deficient in our body. So vitamin D deficiency in children causes rickets, and in adults it causes osteomalacia. It also works in conjunction with parathyroid hormone, and promotes bone health. So causes of vitamin D deficiency include malnutrition. Malnutrition patient is not taking vitamin D, fat malabsorption syndrome, decreased exposure to the sun, liver disease, and chronic renal failure. Then there is clinical manifestations of the disease. So, in if you are seeing young children, then there is rickets. So, I have discussed all of the diseases related to vitamins. I'm not just discussing vitamins. I'm discussing the diseases that are caused by the deficiencies of these vitamins, and then how to treat them as well. So it's a complete lecture. Kindly be attentive. I'm not just discussing vitamins and this and that. I'm discussing their clinical manifestations as well. The things we need most in our lives. Me being a doctor, we see these things daily. So I want to deliver what I know being a doctor, what I know about vitamin deficiencies and how people suffer from vitamin deficiencies. So be attentive. This is a very, very important lecture. Our next lecture will also be very important. We will talk about minerals, we will talk about iron deficiencies, zinc deficiencies, and many other deficiencies. But this day is for the vitamins, so be attentive. Rickets. Rickets is widespread all over the world. And just because of this problem, many children suffer. It's seen in young children in underdeveloped world, skeletal deformities resulting from disruption of mineralization at epiphyseal plates. So epiphyseal plate is basically the end of the bone, where growth of the bone occurs just above the joint, just adjacent to the joint the bone grows. That is epiphyseal plate. Bowing of legs in children, shortened stature. Definitely when bones cannot get elongated enough, the stature will be short just because of vitamin D. Pigeon breast resulting from sternum protrusion. Rachitic rosary, costochondral junction thickening. So basically reddish thickening of the costochondral junction. Costochondral junction is here. So basically, costochondral junction is where ribs join sternum in front of our chest. It is costochondral junction. Costochondral junction. Here, rachitic rosary appears. Reddish spots appear. Late closing of fontanelles. Fontanelles are the openings in our skull bones that are present in infants only below 1 year of age, and they get closed by 12 months, or I think 15 months of age. So late closing of fontanelles, definitely there is no bone formation. Craniotabes, so basically thinning of occipital and parietal bones. Occipital and parietal bones are present in the skull. So basically all of these problems are present in children. So whenever you see a child with skeletal deformities such as bowing of legs or pigeon breast, you should suspect vitamin D deficiency. Then if a child has not seen vitamin D deficiency in his childhood and he has become an adult, and then after becoming an adult his vitamin D deficiency has started occurring, then osteomalacia. Malacia means softening, osteo means bones. So diffuse bone pain occurs, softening of the bones occurs, so the strength of the bones is lost. Muscle weakness also occurs along with osteomalacia. Pathological fractures start to happen. Pathological fracture is a fracture which is a spontaneous fracture. The patient did not fall from some height, but the patient just tipped his foot and fell on just 3 feet slab. He did not fall from some height. He did not have a high um, intensity trauma. There was no such thing. He was just playing rugby, and he fell. Okay, he fell in a routine manner, and he had a fracture of his long bone. That is a pathological fracture. So a fracture without intense trauma is a pathological fracture, and it comes evident when there is vitamin D deficiency. Hypocalcemia occurs. Yes, hypocalcemia occurs because calcium levels are regulated by vitamin D and parathyroid hormone. Radiographs demonstrate diffuse radiolucency with thinning of cortical bones. So radiolucency means that bones are not as white as they should be. Normally, when we see an X-ray, the bones appear white, but when there is less white color in the bones in an X-ray, then there is radiolucency in the bones, and that radiolucency is just because of the vitamin D deficiency. There are other causes as well, but majority cases are due to vitamin D deficiency. So vitamin D supplementation, adequate sunlight exposure, see, these two are their treatments. We give vitamin D to the patient and we advise adequate sunlight exposure and dairy products and meat as well. 200,000 international unit ampoules for oral or IM administration are used to treat vitamin D deficiencies in different regimens. So different regimens means that some of the diseases need extended period of supplementation with vitamin D, and some diseases need supplementation for only 3 months, but some diseases or some conditions need 6 months supplementation or 1 year supplementation. There are different regimens. I will not go into the details of the regimens here because we are not discussing medicine here. Toxicity, clinical manifestations of vitamin D toxicity include hypercalcemia, calcification of soft tissues, kidney stones, and bone mineralization. So we do not give the vitamin D in excess because it will create a problem in the calcium balance in our body. So we do need vitamin D, but we do not need it in excess because then calcium level of the body will go up. And hypercalcemia means increased than normal calcium levels in the blood. Hypocalcemia means decreased than normal calcium levels in the blood. Calcification of soft tissue. So calcium will start depositing everywhere. It will start depositing in the kidneys. It will start depositing in the muscles, in soft organs as well, and bone remineralization. Vitamin D toxicity can also be seen in sarcoidosis, in which abnormal cells convert vitamin D into active metabolites. Sarcoidosis is a very dangerous disease, and it also results in vitamin D excess in our body due to abnormal cells. Vitamin E. So vitamin E is also called tocopherol. It is present in cereals, almonds, and dry fruits and vegetable oils. So functions of vitamin E are it's basically an antioxidant. Vitamin D is believed to be to act as an antioxidant, reacting with free radicals and thereby protecting cellular membranes from damage. Deficiency of vitamin E deficiency occurs in fat malabsorption syndrome, A beta lipoproteinemia. Vitamin E deficiency manifests clinically with vision disturbances, hemolytic anemia because of increased fragility of RBC membranes. So hemolytic anemia is basically anemia due to increased red blood cell destruction in our body. It's not because of an iron deficiency problem. It's because the red blood cells that give our mm, blood the red color, and the red color is due to hemoglobin, these RBCs start getting destroyed to the level that our body cannot replace them. So that is hemolytic anemia. Then there are neurological dysfunction. Neurological dysfunction means problems with our nervous system, ataxic gait, areflexia. Areflexia means there is a loss of reflexes in our muscles. Then there is decreased proprioception and myopathies. Myopathies means the diseases of the muscles, the problems with the muscles. Pathology means any problem that is not normal. Myo means muscles. So myopathy means the problems of the muscles. Then proprioception is basically the term used for ability to differentiate between 2 points of our body. As if I touch my shoulder with 2 fingers and I'm able to tell that I'm not touching with 1 finger but 2 fingers, these things are proprioception. And proprioception is also used in our balancing of our joints. When we are standing, we do not know that we are standing upright and we do not need to fall. All of these things are involuntarily being controlled by our brain. So when vitamin E deficiency occurs, our brain loses its ability of proprioception of our body, so we lose balance in many things. So vitamin E deficiency causes hemolytic anemia. Vitamin E deficiency may result with spinocerebellar ataxia and which most closely resemble Friedreich's ataxia. Ataxia means abnormal gait, inability to walk normally in a normal balance. That is ataxia. Vitamin E deficiency presents in late childhood or early teens with symptoms of progressive ataxia and clumsiness, with exam findings of large fiber sensory loss, areflexia with positive Babinski signs. This is a sign which neurologists perform when they see their patients. I will not go into details. Spinocerebellar or cerebellar signs of dysdiadochokinesia or dysarthria. So dysdiadochokinesia is basically ability to predict the movement of your hands or the movement of your body with your eyes closed. So when our eyes close, we are still able to pick a glass of water. We are still able to pick a pen on the floor. We're still able to unbutton our shirt. We are still able to do many chords, which we do not even know that these are being controlled by our brain. So this diadochokinesia occurs when our cerebellum, which is a part of brain, starts functioning abnormally, and cerebellum needs vitamin E. So all of these problems start to appear. Dysarthria is also the problem with the joints and their balancing. So basically, vitamin E is needed by the brain, cerebellum, especially for controlling the balance of our body. Vitamin E deficiency is often mistaken for vitamin B12 deficiency because of the combination of motor and sensory findings. Yeah, vitamin B12 deficiency we will discuss ahead, that it also causes motor and sensory findings. It also causes neuronal findings. But importantly, in B12 deficiency, there is a megaloblastic anemia with hypersegmented neutrophils and elevated serum methylmalonic acid levels, which are not present in vitamin E deficiency. So, yeah, vitamin B12 deficiency causes megaloblastic anemia. Megaloblastic anemia means the size of the RBCs increases. So it's larger than normal RBCs in our blood. When we see the RBCs in microscope, they are they are megaloblasts. They are larger than normal red blood cells. And the neutrophils, which are white blood cells, they are hypersegmented. So these are the findings of vitamin B12 deficiencies, which are not present in vitamin E deficiency, other than nervous system findings. Then there is vitamin K, which is also called hydroquinone. Vitamin K is also fat soluble vitamin. It is derived from the diet, especially green leafy vegetables, and from bacterial production in proximal intestine. Vitamin K is integral for hepatic synthesis of prothrombin, which is factor 2 and factor 7, 9, and 10. These are coagulation factors. These are the factors which help in clotting our blood when we suffer any injury. So, vitamin K is integral for hepatic synthesis of prothrombin, factor 7, factor 9, factor 10, and also protein C and protein S, which also contains 4 gamma carboxyglutamate residues. Vitamin K is necessary for the carboxylation of glutamate residues to form these rare amino acids. Vitamin K acts as a cofactor for glutamate carboxylase, which catabolizes post-translational F carboxylation of glutamic acid residues and clotting factors 2, 7, 9, and 10, and thereby results in superior activation of the coagulation cascade. I will not go into details of the biochemistry involved here because it is beyond the scope of this lecture. What is post-translational F carboxylation of glutamic acid residue? I will not go into details, but you need to remember that these clotting factors 2, 7, 9, and 10, these clotting factors which help in clotting our blood after an injury to any blood vessels, these factors need vitamin K for their activation and synthesis. Vitamin K assists in bone growth and integrity of bone and promotes teeth as well. It also helps vitamin D in bone growth as well. Vitamin K deficiency caused by fat malabsorption syndromes and use of broad spectrum antibiotics, which serve to suppress bowel bacterial flora, thereby decreasing the synthesis of vitamin K. So, any fat malabsorption syndrome will result in vitamin A, D, E, and K Deficiency, because all of these are fat soluble vitamins. And there is also evidence that broad spectrum antibiotics use also decrease vitamin K levels in our body, because they kill all of the bacteria in our intestine which synthesize vitamin K for us. Clinical manifestations may be asymptomatic in mild cases, or may be present, or may present with bleeding from mucous membranes, impaired blood clotting, and increased bruising. So treatment is vitamin K supplementation. Vitamin K supplementation is vitamin K tablets are there at local pharmacies. If they are advised by your physician, you need to take them. Infants are always given a dose of vitamin K at birth, because they are born with mild vitamin K deficiency resulting from poor diffusion of vitamin K across the placenta, as well as decreased intestinal flora and subsequent decreased vitamin K synthesis. So leafy vegetables are there. Hepatic synthesis of factor 2, 7, 9, 10 protein C. So vitamin K is activated into vitamin K epoxide, and vitamin K epoxide is a active form. This vitamin K epoxide is then converted into vitamin K quinone by warfarin, and then warfarin again it converts into hydroquinone. So that is why we give warfarin as a blood thinner, because warfarin inactivates vitamin K. So when warfarin inactivates vitamin K, vitamin K is lost from the body. Active form of vitamin K is lost from the body, and when active form of vitamin K is lost from the body, all of the clotting factors which are present in our body, they start to get depleted, and within 48 to mm, uh, 72 hours, the chlorine factors deficiency occurs and our blood starts getting thin. And blood thinner is basically an anticoagulant mm, medicine is warfarin. We give them in procoagulant states. We give warfarin in procoagulant states where there is excess of clotting in our blood and we need to thin our blood. I will not go into further details because it will go beyond the scope of this lecture. Fat soluble vitamins. So fat soluble vitamins A, D, E, and K differ from water soluble vitamins. They are insoluble in the watery GI juices. Fat soluble vitamins require bile for their digestion and absorption. Fat soluble vitamins are stored primarily in the liver and fat cells, as we have already discussed. This is just a diagram I added just to summarize it. So vitamin A, vitamin D, vitamin E, vitamin K, their RDIs are mentioned. You people can see these RDIs later. I have shared the presentation with the administration, so this file will be shared with you. The RDIs uh, are mentioned for all of the vitamins, and food sources are drawn here. And we have already discussed the food sources of all these things. So if we keep taking a balanced diet, and we are not suffering from any kind of, God forbid, any kind of malabsorption syndrome such as celiac disease and inflammatory bowel disease, we will not suffer from these vitamin deficiencies. And the next topic is water soluble vitamins and their deficiencies. This section will shed light on functions and deficiencies of water soluble vitamins. So water-soluble vitamins are also essential nutrients which play many important roles in our body. Their RDS sources and functions are described in the table. Yeah, this table is very important. This table, I had already added this table in our first class as well. So I've picked this table from our first class. So vitamin B1 is present in foods, fortified cereals, oatmeals, meat, rice, and pasta. Functions: it helps release energy from carbohydrates, drug metabolism, growth, and muscle tone. So this layer, you people can uh, summarize and memorize this table, as this table is very important. Daily requirements of these vitamins are mentioned. Their best food sources are mentioned here, and their major functions are mentioned here. I will not just read it out loud because you people can read it later. I will just skip on to the details. So, thiamine, vitamin B1. So, I have written the new nomenclature as well as the old nomenclature, which is vitamin B1, B2, B3, B5, B6, but their new nomenclature names, their biochemical names as well. So, thiamine was the first vitamin identified. Vitamin B1 many years ago. RDA is 1.2 milligram for adult male. It functions as a catalyst in generation of energy through decarboxylation of branched chain amino acids and alpha keto acids, and acts as a coenzyme for transketolase reactions in the form of thiamine pyrophosphate. Thiamine also plays an unidentified role in propagating nerve impulses and taking part in myelin sheath maintenance. Yeah, the mechanism is still unidentified. Neurophysiologists are still doing experimentation with thiamine. They do not know how thiamine helps in propagating nerve impulses, but yes, thiamine does help in propagating nerve impulses, and it also takes part in myelin sheath maintenance. What is myelin sheath? So the neurons have axons and dendrites, and these axons and dendrites are covered by a protective sheath, which also helps in nerve impulse propagation as well as maintenance of those axons and dendrites. So, thiamine plays an important role in myelin sheath maintenance and propagation of nerve impulses. The mechanism is still unknown. Neurophysiologists are still experimenting with the mechanism of how thiamine helps these nerves. Thiamine deficiencies is disorders include dry beriberi, wet beriberi, and Wernicke's encephalopathy. So dry beriberi occurs when the CNS is involved, when nervous system is involved alone. Then that deficiency disorder is called dry beriberi. So this condition is usually due to poor intake. The neurological features include impaired reflexes and symmetrical motor and sensory deficits in the extremities. And symmetrical motor and sensory deficit means if your hands are involved, your both hands are involved. If your joints are involved, your both wrist joints are involved. If your elbow joints are involved, your both elbow joints are involved. And similar with the feet. If your feet are involved, then your both feet are involved. If your ankles are involved, then your both ankles are involved. So there is a symmetrical deficit in motor and sensory sensations. Asymmetrical deficit means that on one side of your leg, you're not feeling any kind of sensations, but your other leg is good. Your other leg is working fine. That is asymmetrical motor or sensory deficit. So, the thiamine deficiency, as it is a systemic deficiency, it causes symmetrical motor and sensory deficits in the extremities. Loss of myelin is seen without any acute inflammation of the nerves. Another variation of dry beriberi is Wernicke encephalopathy. This condition presents in well-defined steps, starting with nausea and vomiting, followed by horizontal nystagmus. So basically, nystagmus is involuntary horizontal movement of the eye, where the eye of the patient keeps moving right, left, right, left, right, left, and patient doesn't even know. But the person looking at him notices that his eyes is unstable. His eye is moving right, left, or up and down. So vertical nystagmus is up and down movement of eye. There is too much knowledge for you people in this class. Yeah, I can understand. It's clinical knowledge, it's doctoral knowledge. But I have to make you understand the basics at least. I have to make you understand. Otherwise, I will keep mentioning these terms, and you people will start wondering what is nystagmus, what is palsy, what is ataxia, what is this doctor talking about? Yeah, I have to give the idea of what is nystagmus. So, horizontal nystagmus is involuntary movement, right left movement at horizontal plane, in the horizontal plane, right and left, right and left. The cornea of the eye, the black part of the eye, keeps moving right and left without the control of the patient. Then there's ocular nerve palsy. The nerve stops to function. There is fever. There is ataxia. Ataxia, we all have already told you, the loss of balanced gait. And there is progressive mental impairment, eventually leading to Korsakoff syndrome. Combined presence of Wernicke's encephalopathy and Korsakoff syndrome is called WKS, Wernicke-Korsakoff syndrome. Wernicke's encephalopathy is a classic triad of ocular abnormalities, eye abnormalities. Ocular means eye, such as nystagmus, ophthalmoplegia. Ophthalmoplegia means um, inability to move the eye properly and painful movement of the eye. Confusion and gait changes such as ataxia. So the patient is confused, patient is having nystagmus. Nystagmus is involuntary horizontal or vertical movement of the eye socket. Ophthalmoplegia, and patient is unable to walk normally. And Wernicke's encephalopathy with additional symptoms of memory loss and psychosis with confabulation. Yeah, if a patient is having ocular abnormalities, confusion, and gait changes such as ataxia, then this Wernicke's encephalopathy. And if Wernicke's encephalopathy, along with additional problems of memory loss, patient starts forgetting things and psychosis with confabulation, then that's called Wernicke-Korsakoff syndrome, WKS. What is confabulation? Confabulation is a neuropsychiatric disorder wherein a patient generates a false memory without the intention of deceit. He's not telling a lie according to his memory. In his mind, there is a false memory. He keeps thinking that he placed the keys on the shelf, while in actuality, he didn't place the key on the shelf. And this happens on daily basis. Yeah, it happens with us as well, that we put something here and we start to forget, and we think that we put it here, not there. But with us, normal people, it happens occasionally, once a week or once a fortnight. But with these people, it happens on daily basis, on hourly basis. They generate false memories about their relationships. They start to generate false memories about the people they are living with, and they are not telling a lie. They think that that thing is true, and that is confabulation. And then there is psychosis. Psychosis is a condition with mind or psyche that results in difficulties determining what is real and what is not real. Symptoms may include delusions and hallucination. Delusions is a wrong thought. Patient is delusional means patient keeps thinking the wrong things about people. And hallucinations means he smells, he hears, and he sees those things which are not real. He can smell a perfume which is not present in the air. He can hear some voices which are not audible to other people. He can see people, he can see things which are not visible to other people. It's just in his mind. There's a whole world in his mind. Among other features, additional symptoms are incoherent speech. Incoherent speech means there is no coherence, there is no balance of words. He doesn't even know what he's talking about. He may talk, I was going to market. No, I am driving a car. And while I am driving a car, I am in the market. The market is in the car. Car is market. He will talk like that. So basically, that is incoherent speech and behavior that is inappropriate for a given situation. Yeah, he will start to undress in front of public. He will start to pee in front of public. So there are many things related with this behavior. So this is psychosis. So if a person is suffering from vitamin B1 deficiency, and if the deficiency worsens, then all of these symptoms start appearing. And what to do? You just give the patient vitamin B1, and within a month, patient is okay, as if nothing happened. So treatment of acute thiamine deficiency with cardiovascular and neurological signs symptoms is 200 milligram IV or orally per oral thiamine 3 times daily until symptoms resolve or improvement plateaus, at which time the patient should transition to 10 mg per day oral thiamine until expected recovery is complete. Another option in acute crisis is 50 mg administered intramuscularly for 2 to 4 days, followed by oral maintenance therapy. So this is treatment. What is prevention? Is to give the patient fortified cereals, meats, rice, and pasta, whole grains. Yeah, whole grains and liver. Then there's vitamin B2 function and deficiency. I think we are running out of time, so I have to speed up. So riboflavin, vitamin B2 is a water-soluble and heat-soluble vitamin that the body uses to metabolize fats, proteins, and carbohydrates into glucose or for energy. In addition to boosting energy, riboflavin is an important for the proper immune system function and healthy skin and hair. Without an adequate amount of riboflavin, macronutrients like carbohydrates, fats, and proteins cannot be digested and maintained by the body. So vitamin B2 is needed for the proper digestion and maintenance of the body related to carbohydrate, fats, and proteins. Riboflavin deficiency can alter iron absorption and cause anemia, which leads to fatigue. Riboflavin is involved in RBC production and transportation of oxygen to the cells. Improvement the amount of riboflavin in the body can increase circulating hemoglobin levels and increase red cell production. Vitamin B2 deficiency can cause fatigue, swollen throat, blurred vision, and depression. It can affect the skin by causing skin cracks, itching, and dermatitis around the mouth, hyperemia and edema around the throat, liver degeneration, and hair loss can also occur along with reproductive tissues. So all of these problems start to appear when we are suffering from vitamin B2 deficiency. Usually people with riboflavin deficiency also have deficiency of other nutrients. In most cases, riboflavin deficiency is reversible unless anatomical changes such as cataracts have happened. So the treatment of vitamin B2 deficiency is it comes in 25 mg, 50 mg, and 100 mg tablets according to the National Institute of Health. The recommended daily nutrient intake riboflavin is 1.3 mg for men, 1.1 mg for women, 1.3 mg for male adolescents, and 1 mg for female adolescents. Recommendations are that pregnant women should take 1.4 mg and breastfeeding women should take 1.6 mg. Yeah, breastfeeding women need more than pregnant woman because the kid has grown up and he takes too much of the milk from the mother and he drains the mother. If oral supplementation is not possible, then injections are an option as well. And we also need to know that whole grains, green leafy vegetables, organ meats, dairy products, and eggs contain riboflavin. So these things need to be taken regularly. Then there is vitamin B3 deficiency, that is niacin. So niacin or vitamin B3 are generic terms for nicotinic acid or nicotinamide, niacinamide. Some people call it niacinamide as well, some biochemists. Niacin or vitamin B3 deficiency results in a condition known as pellagra. Pellagra includes the triad of dermatitis, dementia, and diarrhea and can result in death. In humans, niacin was discovered through the niacin deficiency condition called pellagra. It is an Italian word and it was discovered in 1700s. Previously, nutritional deficiency was the commonest cause of pellagra in the world. However, this is no longer true in developed countries. Yeah, developed countries, where it has been nearly eradicated as a manifestation of primary nutritional deficiency. Instead, it now presents as a consequence of chronic alcoholism, malabsorption syndromes, adverse drug effects, and anorexia nervosa. Anorexia nervosa is usually a condition of teenage girls who think that if they eat something, they will get fat, and even though they are skinny, they still think that they are fat. They still think that their weight is too much, so they stop eating altogether, and it's a very serious condition because you have to feed the patient by force. It is usually a 14-year-old or 15-year-old girl who has stopped eating altogether due to fear of getting fatty. In obesity is their main concern. They do not care about vitamin deficiencies and macronutrient deficiencies as well. In some foods, such as corn, niacin can be covalently bound to carbohydrates or small peptides, decreasing the bioavailability for absorption in the small intestine. Therefore, some of the earliest signs of pellagra occur in population consuming a high corn-based diet. So basically, in corn, niacin is covalently bound with carbohydrates or small peptides, decreasing the bioavailability for uh, niacin. So basically, this niacin then is unable to get digested in our body, and thus the problems start. So high corn-based diet should be avoided if people care about niacin. It should be a balanced diet, sometime wheat, sometime rice, sometime corn, sometime barley. So it should be a balanced, stable diet, not just corn-based diet. So drugs, alcoholism, gastrointestinal tract diseases, and malignancies are the common cause of secondary pellagra. Excessive and chronic alcohol intake. Yo, chronic alcoholism is the mother of all problems. Keep telling everyone that chronic alcoholism is the mother of all these deficiencies. Excessive and chronic alcohol can induce plagra, just like vitamin B2 deficiency, just like vitamin B1 deficiency, just like all other vitamin deficiencies. Chronic alcoholism is the mother of all problems. So excessive and chronic alcohol intake can induce plagra due to reducing the absorption of niacin. Alcohol use disorder is associated with increased malnutrition and can impair the conversion of tryptophan to niacin as well. Tryptophan is converted into niacin in our bodies as well. So alcohol also stops the conversion of tryptophan to niacin in our bodies. Niacin is primarily absorbed in the small intestine, therefore malabsorptive disorders such as chronic diarrhea, inflammatory bowel diseases, celiac diseases, malignancy, etc. can impair niacin absorption. What is plagra? 3Ds, dermatitis, dementia, and diarrhea. Similar to a sunburn, brown discoloration and skin lesion on the skin typically exposed to the sun, such as hands, elbows, knees, and feet are present. So, if a dermatologist sees a patient, he will label that patient as just having a sunburn. But the problem will not be with the skin. There will be neurological changes as well: anxiety, poor concentration, fatigue, and depression. So, whenever you see a person with discoloration of skin, you take a proper history about his diet as well. And you also start about neurological changes, whether the patient always keeps getting anxious as well or not. Also get gastrointestinal complications such as glossitis, cirrhosis, pneumatitis, nausea, vomiting, and diarrhea or constipation may be present. So there are 3Ds in plagra, which is a niacin deficiency problem. There is dermatitis or the skin condition, there is dementia, there is poor concentration, loss of memory, anxiety, fatigue, and depression. And there are also oral ulcers, inflammation of the tongue. Cheilosis means the angles of the mouth also start getting ulcerated. Stomatitis. Then there is nausea, vomiting, and diarrhea as well. So the treatment management, the basic principle of treating niacin deficiency is the correction of underlying cause of niacin deficiency, but replacement of niacin is a must. For susceptible persons, preventing measures reduce the risk of developing the disease. One of these steps is supplementation. A niacin deficiency may indicate multiple nutritional deficiencies. Therefore, a balanced diet is a strong recommendation. Nicotinamide doses of 250 to 500 mg per day orally should be given, despite nicotinic acid being the more common form of niacin. Nicotinamide is used for niacin deficiencies and it does not cause symptoms such as tingling sensation, itching, or flushing. Yeah, nicotinamide is the drug of choice for niacin deficiency, not not a nicotinic acid. Patients with plagra should avoid sun exposure and alcohol intake. Again and again, stop chronic alcoholism. It ruins all of your vitamin absorption in the body. For patients who receive isoniazid for TB prophylaxis, yeah, if a person is suffering from tuberculosis, B complex multivitamin, B complex is all of the B complex, vitamin B1, B2, B3, B6, B12, etc. B complex multivitamin or nicotinamide supplementation should be considered to prevent niacin deficiencies. Then there's pantothenic acid. It is not that important, but still we have to discuss because it is a vitamin, it is an essential nutrient. Vitamin B5, pantothenic acid, is a naturally occurring substance in various plants and animals, eggs, milk, vegetables, beef, chicken, and whole grains. Vitamin B5 is also supplementally added to food in developed world. Deficiency of this vitamin is a rare, but can present in people with severe malnutrition. Yeah, this vitamin deficiency is rare. If person is suffering from severe malnutrition, then vitamin B5 is also deficient in that person. A patient with vitamin B5 deficiency commonly has deficiency in other nutrients as well, making it challenging to identify vitamin B deficiency specifically. An experimental vitamin B5 deficiency study associated with the deficiency studied the deficiency with symptoms such as fatigue, headache, malaise, personality changes, numbness, muscle cramps, paresthesia, muscles, abdominal cramps, nausea, and impaired muscle coordination. So it was an experimental study because they couldn't find an isolated case of vitamin B5 deficiency in the Western world. Vitamin B5 is exclusively a precursor of coenzyme A synthesis and thus only directly affects this metabolic pathway. Coenzyme A has a role in hundreds of human biochemical reactions such as cell growth, intermediary metabolism, and neurotransmitter synthesis. Definitely, coenzyme A needs vitamin B5, and vitamin B5, if not present, affects these reactions. Dietary supplements of vitamin B5 are available as vitamin B5 exclusively or in combination with other vitamins in multivitamin, multivitamin mineral products. Depending on the application, derivatives of vitamin B5 can be applied topically and even through injection using IV formulas. Dexpanthenol and alcohol-based derivatives of vitamin B5 administration can be administered via an oral spray in the mouth. Dietary supplements commonly contain varying amounts of pantothenic acid. The quantity typically varies between 10 mg and 1000 mg depending upon the need of the patient. Adult should take 5 mg per day, pregnant woman 6 mg per day, lactated woman 7 mg per day. Pyridoxine, vitamin B6 deficiency functions and deficiency. It is also water soluble vitamin. So all of these are water soluble vitamin B, starting from vitamin B1, B2, B5, B6, B3. All of these are water soluble vitamins. So water soluble vitamin B6 present in many foods, including meat, fish, nuts, beans, grains, fruits, and vegetables. As a coenzyme, vitamin B6 is a cofactor in over 100 enzymatic reactions. It contributes to neurotransmitter synthesis, interleukin 2 production, and hemoglobin formation. Yeah, interleukin 2 helps in many things. It helps in our immune system, it helps in our neurotransmitter synthesis as well. So it plays a crucial role in gluconeogenesis and glycogenolysis. Vitamin B6 is critical in transamination and decarboxylation, the initial steps of porphyrin synthesis. Pyridoxine influences cognitive development due to its involvement in neurotransmitter synthesis and immune function because of its role in IL-2 production. It is also essential in hemoglobin synthesis. Fetal brain development requires adequate vitamin B6, and this continues throughout infancy. That is why these vitamins are necessary from day one of childbirth. And all of these vitamins are either secreted in breast milk or fortified formula milk. There is no other option. The best of the best option to raise an infant is to give him breast milk. The mother's milk is a wholesome diet up till 5 months or 6 months of age. At least 4 months of age, yeah. Mother's diet contains everything needed for the optimal growth of mother's milk. Sorry, mother milks contains everything related for the needed for the optimal growth of the child. So fetal brain development requires adequate vitamin B6, and this continues throughout infancy. Pyridoxine, vitamin B6 deficiency is often associated with other vitamin B deficiencies as well, such as folic acid and vitamin B12. Low plasma level of active vitamin B6 are found in individuals with chronic alcohol dependence. Yeah, again alcoholism, again and again alcoholism, obesity, and protein energy malnutrition. Marginal vitamin B6 deficiency causes oral stomatitis, glossitis, chelosis, irritability, confusion, and depression. May also occur. Severely deficient adults may present with seborrheic dermatitis, microcytic anemia, and seizures. Yeah, there is microcytic anemia, not megaloblastic anemia, as seen in vitamin B12 and folic acid deficiency. Patient may present with seizures as well. Neonates and infants with an inborn error of pyridoxine metabolism may exhibit severe refractory seizures that respond only to pyridoxine administration. In pregnant women, vitamin B6 deficiency has been linked with an increased risk of preterm birth and early pregnancy loss. Because many pregnancies are unplanned, all women of childbearing age should consume adequate amounts of vitamin B6 in their diets or with supplements because severe vitamin B6 deficiency may also cause an abortion or miscarriage. Vitamin B6 deficiency in treatment in vitamin B6 deficiency state and illnesses treatment dose varies with the patient's age and severity of symptoms. The vitamin B6 is available in both oral and for Formulations parenteral means intravenous formulations. Neonates with suspected pyridoxine dependent seizures should be given pyridoxine 100 mg IV. Infants diagnosed with pyridoxine dependent seizures require lifelong treatment. A wide range of dosing has been recommended from 5 to 20 mg per kg per day to 500 mg per day as well, depending upon the need of the patient. For hyperemesis gravidarum, pyridoxine 25 mg administered 3 times a day. Isoniazid can interfere with vitamin B6 metabolism and result in vitamin B6 deficiency. That is why PB medications always contain pyridoxine in them. Dose recommendations range from 6 to 50 mg daily as prophylaxis to 100 to 200 mg daily if neurotoxicity and documented vitamin B6 deficiencies develop. Then there is vitamin B7. Vitamin B7 is also called biotin. Biotin, vitamin H, or vitamin B7 is also a water-soluble B-complex vitamin that serves as an essential coenzyme for 5-carboxylases. Pyruvate carboxylase, 3-methylcrotonyl coenzyme A carboxylase, propionyl coenzyme A carboxylase, coenzyme for acyl coenzyme A carboxylase 1 and 2. Biotin deficiency affects the activity of biotin-dependent carboxylases. These carboxylases facilitate various metabolic reactions such as gluconeogenesis and fatty acid synthesis and amino acid metabolism. Biotin deficiency is very rare in those who take in normal balanced diet. Mammals obtain biotin from food. Foods rich in biotin are egg yolk, liver, cereals, wheats, oats, vegetables such as spinach, mushroom, and rice. Dairy items and breast milk also contain biotin. Besides, gut microbacteria gut microbacteria can produce biotin as well. Consuming large amounts of egg whites can lead to acquired biotin deficiency. Raw egg whites, not boiled egg whites. Raw egg whites can also lead to acquired biotin deficiency. Raw egg contains the glycoprotein avidin. Avidin binds to biotin in the GI tract and prevents biotin absorption, also known as egg white injury. Biotin deficiency leads to variable clinical manifestations, mainly neurological and dermal abnormalities. Dermal abnormalities in biotin deficiency are due to impaired fatty acid metabolism. They include hair loss, periorificial dermatitis, scaly red rash around the orifices, eyes, nose, and mouth. There is scaly red rash around the eyes, nose, and mouth. This is called biotin deficient facies. The rash is similar to that of zinc deficiency. Patient may also develop conjunctivitis and skin infection. So there is hair loss in biotin deficiency. And there is periorificial dermatitis. So all of the orifices, there is a rash surrounding these orifices, such as eyes, nose, and mouth. And the rash is very similar to zinc deficiency. It is disquamitous rash. Patient may also develop conjunctivitis and skin infection. So neurological symptoms include hypotonia, seizures, ataxia, numbness, and mental retardation and developmental delay in children. While patient may show depression, lethargy, and history of hallucinations as well. Other neurological abnormalities include optic atrophy and sensory neural hearing loss if the condition is left untreated. After 3 to 4 weeks of having a raw egg diet in adult humans, this squamatic dermatitis was observed. After 5 weeks, anorexia, lethargy, and hyperesthesia developed. So this was an experiment. They kept giving raw eggs to adult human beings just as an experimental thing. And disquamative dermatitis means there is skin disquamation. Skin starts getting peeled off as if you rub something and it gets peeled off, just like paint gets peeled off from some shiny surface. So disquamative dermatitis means skin inflames and it gets starts getting peeled off, and you can see the flesh. So it is a very painful condition. So if adult human being is given raw eggs for 3 to 4 weeks, and after 5 weeks, anorexia, lethargy, and hyperesthesia develop. Administration of biotin relieves symptoms in 5 days. Infants may initially show mild scaly erythema and dermatitis on the face, which may resemble dermatitis rash to soaps as well. So biotin deficiency management essentially means treating the cause. Lifelong treatment with biotin supplements is required in patients with genetic disorders disrupting biotin metabolism. If the deficiency is related to excess consumption of raw eggs, it should be stopped and biotin replacement should ensue. Some anti-epileptic drugs also cause biotin deficiencies as well. So change anticonvulsants if the deficiency is because of the use of a particular anticonvulsant such as carbamazepine. Similarly, those on prolonged oral antibiotic therapy may also benefit from biotin supplementation. Oral biotin supplements have high bioavailability. Usually, a dose of 5 mg per day is given regardless of the etiology of biotin deficiency. The Food and Nutrition Board of National Research Council recommends a range of 5 microgram per day in newborn infants and 35 microgram per day in lactating women. So now there are two vitamin Bs remaining. How much time do I have? Because I need to know, uh, sir. How much time do I
Actually,
have? Can I
actually,
can
I
I go?
sent you I sent you a text about close to half an hour ago to let you know that we had 15 minutes to go. This is the
Oh
very
my God.
first time we are running out of time. I mean,
Okay, there are
since
just three vitamins remaining. There are just three vitamins remaining. I will just wind it up because I had to cover all of the vitamins, and it is a very interesting topic. So I couldn't cover it up. Okay, I will hurry it up. So folate, vitamin B9 deficiency, functions and deficiency. Folate is an essential water-soluble vitamin naturally present in food, especially in fruits, green leafy vegetables and liver. Folic acid is the synthesized form of folate present in 45 foods and supplements. Folate has been added to grains in the United States as well. Folate, like vitamin B12, is a provider of one carbon residues for DNA and RNA synthesis. That is why folic acid is essential for DNA and RNA synthesis in our cells. Folic acid deficiency can arise from multiple causes, including inadequate dietary intake. Heating during cooking also destroys folic acid. Folate is absorbed in the jejunum by active and passive transport mechanism across the intestinal wall. Celiac disease, tropical screw, short bowel syndrome, gastric bypass surgeries, or any other disease of the gut where absorption is lost, folic acid deficiency occurs. Drugs such as methotrexate, phenytoin, sulfasalazine, etc. also antagonize folate utilization, inhibit its absorption and conversion to its active form. Congenital deficiency of enzymes all required in folate metabolism can also lead to folate deficiency. Folic acid deficiency can occur subsequent to vitamin B12 deficiency as well, as vitamin B12 helps in activation of 5-methyl tetrahydrofolate to active form, that is THFA, simple tetrahydrofolate. The deficiency of folate leads to impairment of cell division. Yeah, cells cannot divide as DNA and RNA cannot form. Accumulation of toxic metabolites, impairment of methylation reactions required for regulation of gene expression. The body has about 1,000 to 20,000 microgram of folate stores, and if you do not take folic acid for 8 to 6 weeks, you become deficient in folic acid. Most of folate deficiency symptoms overlap with the symptoms of vitamin B12 deficiencies. The physical exam may reveal pallor, patient will be pale, there will be painful, beefy red tongue with oral ulcers in the body, in the mouth. Signs of anorexia may be present, and the neurological exam may reveal cognitive impairment, depression, and dementia. Patients using methotrexate or pregnant and lactating mothers are more prone to develop folate deficiencies. So all of these patients need folate supplementation as well. There is a difference between folic acid and vitamin B12 deficiency. So if there is a folic acid deficiency, you need to confirm whether there is a vitamin B12 deficiency as well. So a peripheral film shows macrocytic red blood cells and megaloblast and hypersegmented neutrophils. So you order vitamin B12 levels of the serum as well to differentiate between the two. Patient will for supplemental folic acid. There is a high availability
we are losing you, Dr. Khan. Dr. Ken, we are not receiving you at this time. Ladies and gentlemen, we
Can you hear me,
right at this time, yes.
sir?
Hello, and we
Can you
have
hear me?
lost. Yes, keep trying, please. Brothers and sisters,
Can you?
I really would like to apologize on behalf of Atlantic International University and, of course, on behalf of Dr. Omar Farooq Khan, whom we happen to be losing at this time. We have had to go overboard.
Can
Uh,
you hear me?
yes, we can hear you now. Please, let's try to wrap up this presentation as the network seems to be not sure overloaded. I'm not again certain as to what's going on at this time. Dr. Khan?
Yeah. My internet is working fine. I do not know what is happening.
Yeah, not on my end. I'm not sure whether the technology department has anything to do about it, but on my end, I'm receiving you well. I am looking at every face of the attendees present for this session.
Sir, can you hear me now? Can you hear me now?
Yes, yes.
Okay, I don't know what happened with my internet because the device is working fine, the signal is fine.
So
Short of
let's
time, we
just
can't
try
even
to
discuss it.
wrap up this session, please, if you
Yeah,
can.
I have to wrap up. Yeah. I have to wrap up. We can discuss this here. Okay, so vitamin B12 deficiency is a very important deficiency as well. So there are many neurological symptoms related with vitamin B12 deficiency. There is glossitis, diarrhea, mental disturbance, etc. in vitamin B12 deficiency as well. So when obtaining a complete GI history, it is important to look for a past medical history of celiac disease or chronic disease as well. Any surgical history of gastrectomy or bowel resection, especially resection of the ileum, should increase suspicion of B12 deficiency. So vitamin B12 supplementation is also very easy to give. You can give oral tablets or IV supplements as well. But you should differentiate between vitamin B12 deficiency and folate deficiency. And there is a test called MMA test, methyl malonic acid test. It's a serum MMA test which differentiates between the two. Or you can just go for the serum vitamin B12 levels or serum folate levels to be precise. Then there is a very important and our last vitamin, that is vitamin C. Vitamin C, also a water soluble vitamin, is an essential nutrient for maintaining an individual's good health and well-being. Vitamin C has significant antioxidant properties that protect cells from free radical damage. In addition, vitamin C also nurtures growth and repair of skin, cartilage, bone, and teeth. Vitamin C deficiency is often low in quantity and limited access to nutritious foods. Vitamin C is naturally available in many foods like citrus fruits, potatoes, spinach, broccoli, etc. The primary cause of vitamin C deficiency is due to inadequate nutritional intake. Collagen is a vital structural protein. Collagen is present in our hair, it is present in our nails, it is present everywhere in our body in different forms. There are types of collagen. It is present in our bones, it is present in every part of our body. It is essential for maintaining integrity and strength of connective tissues throughout the body. Type 4 collagen forms the primary building block of blood vessel walls, skin, and the basement membrane that separates the epidermis from the dermis. Collagen constitutes 75% of the dermis. Vitamin C is the cofactor for proline and lysine hydroxylases, which stabilizes collagen types 1 and 6. Furthermore, this vitamin enables cross-linking and facilitates pro-collagen transcription to collagen. So basically, the strength of the collagen is deficiency. A deficiency in vitamin C also results in epigenetic DNA hypermethylation, inhibiting the transcription of collagen in various tissues. Insufficient collagen production in the body results in fragile skin and blood vessels, gingival hemorrhages, petechiae, and impaired wound healing occurs. Vitamin C deficiency compromises immune function as well. Causes of vitamin C deficiencies are alcohol use disorder, infant feeding practices. I will not go into details. You can read the details later. Social isolation and dietary habits. Socially isolated people are on a limited diet. They usually take tea and toast. They do not eat fruits and vegetables. Thus, they do not get vitamin C. Limited access to fruits and vegetables is also a cause of vitamin C deficiency. Excessive exercise is also a cause of vitamin C. Eating disorders such as anorexia nervosa can also cause vitamin C. All other vitamin deficiency, type 1 diabetes, then malabsorptive disorders, bariatric surgeries. All of these conditions result in vitamin C deficiency. Scurvy is a disease which is caused by vitamin C deficiency, and it is a very devastating disease. Initially, non-specific symptoms of scurvy emerge after 4 to 12 weeks of insufficient intake of vitamin C. Patients might present with fatigue, malaise, lethargy, and anorexia, but then patients come with bleeding gums, easy bruising, and skin rashes, impaired wound healing, and bone and joint aging. Mucocutaneous inflammation is also present, and there are various organ systems involved as well. There are painful joint swelling, hemarthrosis as well. Hemarthrosis means the presence of presence of blood in joints. Subperiosteal hematomas as well. Then disrupted endochondral bone formation and other problems also start from the treatment and management is appropriate dosage of vitamin C for scurvy treatment, then prompt vitamin C supplementation, and point of replacement typically occurs within 1 to 3 months. The dosage are written here. You can read them later. Treating scurvy involves consuming sufficient fruits and vegetables to prevent recurrence. There are underlying cause of malnutrition that lead to vitamin C deficiency. The recommended daily vitamin C intake varies based on age, sex, pregnancy, lactation. The amount of vitamin C recommended for children is 15 to 75 mg, men 90 mg, women 75 mg, pregnant women nearly 90 mg, and children 120 mg. Have a nice day. If there is any time left, I can take your questions if sir allows me. Otherwise, we will have to take the questions with our next class when we will discuss the mineral deficiency disorder.
Thank you. Thank you very much,
Mineral
Dr.
deficiency
Omer
disorder
Farooq.